A sort of meeting of, three of the main unions there. We've got the GMB, Unite and Unison, with what appears to be incredulity and growing anger at what the Health Secretary said. This quote about the unions had made a conscious decision to inflict harm on patients. What has been the reaction of people there?
Well, there's been a very angry reaction from the Unison members behind me, and I think one of the things they've been saying to me is the frustration of the lack of nuance from the government. We had quotes from Stephen Barclay today sort of throwing around figures of what nurses in Scotland were demanding in relation to ambulance workers here in England, and what they're demanding is not what nurses are asking for. Nurses have asked for 19%. The unions, in regards to the ambulance workers, have asked for something in line with inflation. They've not actually given a specific figure. In fact, the GMB union said they would take a 7.5% pay rise and they would put that to vote with their members. But they've not given a specific figure, and of course something in line with inflation would be about sort of 10%. So that is well below what the nurses are asking for. And I think the frustration I'm hearing from some of the ambulance workers is the lack of nuance from the government, sort of tarring all unions with the same brush. We've got three different unions striking today, which is very different to the nurses' strike, which was just one union. And I think they're frustrated that the government is sort of, in their view, doing a sort of blanket approach to what unions are wanting in regards to healthcare. But actually, they would say it's not giving enough. Sort of the demands are different from both unions and from ambulance workers as opposed to nurses.
And in terms of the public reaction, it does seem to be a feature of all these picket lines across the country. We've got all these car horns with people signalling their support for the ambulance workers.
Yes, there has been a lot of support, but I think the mood here is actually very different to when we were last speaking from the picket line for the nurses. And I think that's partly because we've got a much smaller number of people here. And that's really because of, as you were just hearing from your previous guest there, is if there are emergencies which are category 1, they have to respond. And so that makes it very difficult for them to strike. And I think actually what we're seeing from these strikes today and next week is very, very different to other strikes. And it makes it much more difficult for them because they will have to leave the picket line, and people I've spoken to say that they are going to have to respond. Well, that makes your striking clout, I guess, a lot less significant. And then you add to that the armed forces are getting involved. Well, the armed forces aren't getting involved with other strikes as well. So again, that makes that sort of slightly undermines the strike in some ways. And I think there is frustration from one paramedic I spoke to that actually the armed forces, the reason they're not going to be putting the blue lights on and the reason they're not going through the red lights, the reason they've got those restrictions in place is because they are not trained in that way. So there's a frustration really from ambulance workers that the armed forces have been brought in, and the government of course is doing that. They will argue to help save lives, but there's a frustration from ambulance workers that they're being brought in without the same level of training, of course, that you'd expect from paramedics.
Indeed. I mean, we heard a siren going off there. I mean, you're aware that people actually have left that picket line as well to answer emergency calls?
They say that they're prepared to. It's still quite early. It only started at midday, but they'll be going on to midnight. But we've certainly seen across the country some picket lines have been very small because people are having to respond, which really should have. And I suppose that's the real difficulty really what we're dealing with is these are emergency workers. This is very distinctly different to, say, nurses who might be involved in, say, palliative care or something like that. So the impact is so significant, and so that's many of them are going to have to leave their post to respond. And we are hearing from ambulance bosses today. They're urging the public to only ring 999 if they think they're going to die. I mean, that is hugely significant, and there will be people who may not feel that they're going to die but perhaps are having a stroke. And it doesn't mean if they fall into that category 2 that they would automatically get an ambulance caller. And of course there are concerns for patients across the country. If an elderly relative was to fall, they could be lying there for significant periods of time. I mean, NHS bosses have said they could lie there for sort of 48 hours. I mean, that is really, really worrying. Of course, you know, ambulance staff sort of say, look, this is not what we want to do. We want to be sitting down with the government. A very strong rhetoric from both sides, each blaming each other for not sitting down to the table.